So we are going to talk about trend analysis today, specifically in relation to using trend data for program evaluation. I have a few things in here about monitoring progress towards objectives too, because, well, we are going to have a discussion today, kind of, you know, the overlap, similarities and differences between performance measurement, program evaluation, and QI. I'm just going to get this out of the way. And then at the very end, actually, speaking of QI, I've added some slides because I, like many of you, are involved with the COIN process, and so we've been, you know, I've been trying to learn what QI means and what the similarities and differences are, and so I've thrown in some slides just to get our conversation going about that. Okay, but let's just do a little bit of groundwork. I assume most of you, I mean, most people in public health do trend analysis. I just want to go through some of the basics first and then really talk about what it means in the context of program evaluation. So these are just some of the kind of different things you have to think about compared to doing other kinds of analysis when you're thinking about trend data, and that is, we're always assuming in most statistical analysis that we have independent observations. That's not necessarily true with trend data because it's really repeated measures through time. And we'll talk about that a little more too. And then smoothing techniques, and then time frame we'll talk about a little bit, and then what we do to assess the accuracy by using confidence bands around trend lines. Really, this comes out of thinking about, at least in my work, and I think in your work, we're doing trend analysis a little bit differently than the way it's been done historically. So we're not looking at huge infant mortality since 1900 to now, you know, so we don't have 114 time points, long secular trends, big population. So sample size, both in the sense of lots of sample size at each time point, and also lots of time points. So we're more interested in doing shorter periods of time and possibly in small geographic areas or for small subpopulations, so that we have small sample size in both dimensions, both at each time point and in terms of the number of time points themselves. There are different reasons to do trend analysis. Just looking at the shape and the general pattern of change over time. Sometimes we do want to compare one time period to another time period, and in fact that's a lot what we'll talk about today, because that's essentially what we're doing in program evaluation. It's the before and after contrast. Often we want to compare one geographic area to another, and a lot of this has to do with the richness of the information, the additional information we get. We can compare geographic areas to each other cross-sectionally, just one point in time, currently, but if the shape of the trends is different, we might learn something else. So even when we're thinking about any kind of disparity, whether it's geographic disparity, racial disparity, whatever it is, that we might see changes in the disparity over time, and we might draw different conclusions. So we might see a wide or a narrow gap right now, but that might have also changed over time. So the trend data just adds depth to our data. And we also may want to use trend data to do forecasting or making projections. And that also in our world has to do with maybe looking at 2020 objectives, or just making a projection with our current data, even not in the context of an objective, just to predict where we might be 5 or 10 or however many years from now. So the small numbers issue is really important for trend data. And often when we do look at small geographic areas or small population groups, what it means is that the rates that we're looking at over time are very unstable, meaning, of course, what wide confidence intervals and what you generally see in that context are, a lot of fluctuation in the trend, and it's like, what? Maybe you can't even, just by looking, you can't see what the slope might be, what the actual trend line might be. And the same kind of thing with sample size, this time in the dimension of the number of time periods themselves. If it's really a short time period, is that how many data points do we need to really feel confident that we're seeing the shape of what's going on? And remember when we were talking the other day about impossible extrapolations, Ashley was talking about you can get impossible numbers if you extrapolate from a log binomial regression analysis. It's the same issue here, right? This is all, if you're using regression analysis to look at trend data, you can extrapolate beyond your data. So if you only have 5 data points and you're going to extrapolate beyond where you are, or even back in time, if you're going to do extrapolation, you're not going to have good, reliable estimates. Okay. The other thing is to think about all of the typical epi issues that we usually talk about, and that is confounding and effect modification. I sort of think about this in my own neighborhood, so to speak. In Chicago, people often want, I don't know if you know this about Chicago, but historically we divide the city into 76 community areas, and they have neighborhood names, and actually people do, like I live in the West Loop, somebody else lives in Lakeview or Lincoln Park or Uptown or Rogers Park or Beverly where Kristen lives, or there's Hyde Park where the University of Chicago is. And often people are interested in looking at trend data for those community areas, except that, well, there's the good news and the bad news. There could be confounding if you think that there's been demographic changes over time, which in many Chicago neighborhoods there have been, then am I really, if I compare 1990 or 1995, take my neighborhood, the West Loop, if I look at data for the West Loop in 1995 and then look at it now, it's a wholly different neighborhood. There's really been a lot of change in that neighborhood over time. So am I really comparing apples and apples? Is it the same place? The bad news in Chicago is we're such a segregated city that in a lot of neighborhoods there hasn't been, there are still the neighborhoods that are all black and the neighborhoods that are all white, and nothing has changed. So that's the bad news from a social standpoint, but then maybe we can compare those neighborhoods over time. So it's just thinking about all of those things, or thinking about policy or program changes that happen, just always questioning when you're looking at trend data, do you need to, in a typical analytic way that we would do in any analysis, think about confounding and effect modification? Let's talk about those smoothing techniques, given that we may have rates that are very unreliable and fluctuating, and it's hard to tell what's going on. So the simplest and most commonly used way to smooth is to do the natural log transformation. And actually, in addition to smoothing, okay, I'm a terrible drawer, but let's try and do this. Get rid of this. I always think about this as infant mortality. So this is year, and these are the infant mortality rates. And if I just model the rates themselves, and get a trend line over time, and let's say we're going to make this a big scale, out to 2050. I'm making this up. And so here we are back here in about 2014. And if the rates are going down, if I don't do something like a natural log transformation, again, this is about extrapolating beyond my data, I'm going to get, let's see, how should we do this? It's a gradual decrease, but eventually you can see out there, the line's going to cross 0. Are we ever going to is that realistic? We're never, even in an ideal world with a National Health Service, and we've addressed all the social determinants of health, we're never going to have infant mortality of 0, right? We wish, but we're not. So with the natural log transform, it just does this, right? It plateaus out here, and it'll never, even extrapolating out, it won't cross the x-axis. It'll never get to 0, which is a more realistic look at what might happen to infant mortality or other rates. Other smoothing techniques are just, this is all about sample size, right? Is what helps smoothing, so we can combine years of data, and there are different ways of combining years of data, so we can just do, the 3-year infant mortality rate, which is really a weighted average over a 3-year time period. We're going to gain stability, so confidence intervals around those 3-year rates will be narrower because we have bigger sample size over a 3-year period. But then, if we only have 10 years of data, we're going to have 3 points to connect with a trend line. So we lose information by doing that. So what many people do is rolling or moving averages, where you've got overlapping rates, so you're going to both gain stability and you're going to maintain enough data points. You're not going to lose sample size on that dimension. Just to remind us what I mean when I say, weighted or unweighted averages. So I don't think any of us do this. We're all epidemiologists. But an unweighted average would be literally taking the arithmetic mean. So, the rates itself, rate in year 1, rate in year 2, rate in year 3, add them up and divide by 3. That's not accounting for sample size at all. Now, you could argue it's going to be close in our world because how much in Illinois is the denominator of the number of births changing year by year? Not much. But we normally do it this way, right? We're going to add up the number of infant deaths over 3 years and then add up the denominators and actually have add up the denominators and use a weighted average that would account for the differing sample sizes, the differing numbers in the denominator. So I've just written that out. Technically, that's a weighted average. You're weighting it by the sample size in each year. Again, for our data, that's maybe not that much of a concern. And so, of course, you got to do this for every 3-year or however, maybe 2 years is enough, whatever your interval number of years is that you want. And then this is the formula the process for doing rolling averages. So you've got overlapping time periods, years 1 to 3, years 2 to 4, years 3 to 5, 4 to 6. So here, year 2 is in this, and it's in this, right? So you're still ending up with almost the same number of data points, but you've accomplished increasing sample size so that you're going to have more reliable estimates. People, do you guys do this? Do you use rolling averages in your data? Yeah, I figured. So we're going to talk a lot about regression, because regression analysis itself is a smoothing technique. if you think about, oh God. Right here you have, like that. And instead of just empirically connecting the dots, you're going to draw the best straight line. That is what regression analysis does, right? So it's a smoothing, accounting for sample size and all of that. It's a smoothing technique in any context, but certainly in trend analysis too. And this gets back to this point about correlated data. In our world, I would argue this isn't so much of an issue, although someone could argue with me, I think so much in perinatal terms. So the idea here is, again, have we violated the assumption of independence? That's one of the basic statistical assumptions in any analysis that we do. If the same people are being looked at year 1, year 2, year 3, year 4, then there's no independence anymore. In the perinatal world, if I think about the birth cohort, first year, birth cohort, second year, birth cohort, whatever, yes, mom's, right? Mom is having pregnancy number 1 in year 1, and then maybe even with good inter-pregnancy intervals, she's having pregnancy number 2 in year 4 or something. So there's some, people being the same woman might be in your analysis over time, but it's really not enough to cause a problem. It's more of a problem. I was thinking about this if you were, if you think about some child health indicator, and there you've got basically a lot of the same kids are going to be in your denominator, whatever the indicator is. Hopefully they're not in the numerator of some, adverse outcome. But you've got kids that are going through time, from ages 1 to 17 or whatever. They're going to be in each year of data over time. Technically, that's an issue, although I don't see in sort of the public health surveillance world that much concern about that. I think it's more of a concern when you think about things, and this is not my area, but if you think about things like, my husband is a air pollution researcher, so they're looking at things like, particulate matter every day over a whole period and trying to model that. Well, day 1 and day 2, whatever is happening in terms of pollution, it's clearly correlated over time. Then that becomes an issue. Have any of you?
I have this issue.
Yeah.
But in our program, especially recently, there's a lot of attention on overweight and obesity among children, especially in the 2 to 5 range. And so in the WIC program, when I look at that, there's a third. 30% is overlap from 1 year to the next. So I would love to hear
how have you been
advice.
handling it?
Well, I just talked to Ashley yesterday.
Oh, and how are you handling it?
She recommended general
estimating equations?
Yeah.
GEE?
So I don't know a lot about that, so I'm going to look into it.
And I barely know about that. But it is kind of, when you think about it, it is similar when we talk about, and GE is used for this too, that's why I'm going to answer this way. When you think about doing, if any of you have done multi-level analysis, so you want to look at neighborhood effects or something, well, what's the problem with that? You've got individuals in a neighborhood that are, right, within neighborhood is more correlated than between neighborhoods. You've got, again, you're violating independence, and that's the same kind of thing. You've got clusters of data. So, some people might use, there are time series analysis procedures that you can figure out what the correlation structure is in your data. SAS has all those procedures. I've only used, I think the simplest one is like proc autoreg, which is a particularly simple, it's just saying there's correlation like in contiguous years, but of course data could be correlated in more complicated ways than that. I have not used GEE, but so that's an interesting option for that. So you just need to be aware, and I guess what I think about here is, like if I were you, I would try it with GEE, do it in a simpler way and see if, like, is it really changing like what you see, and how is it changing what you see? And I mean, what's probably going to happen is it's going to change the way standard errors are calculated and that sort of thing, accounting for the correlated structure in the data. So this gets back to plugging numbers into the equation. Here's a simple regression equation using the natural log transform. So you see the natural log of the rate. So this is all at the aggregate level, right? This isn't individual level data. This is, years are the unit of analysis. So you've got in some file, year 1, year 2, year 3, so maybe you only have 10 rows of data for the 10 years, and then you've got other aggregate data, whether it's rates, and it might be other things, other kinds of variables too. But this is just simple, so it's the log of the rate, and you've got an intercept term and a slope parameter with year as the x variable, and you could have other covariates at the aggregate level. And then what I've shown you here is the way to calculate annual percent change, which I think Ashley also talked about at some point. I don't remember where this came up. So, wrong thing. So you've got, this is a difference up here, like the difference between, year 5 to year 1, something like that, or however many data points you have, and the earlier in the denominator. So this is how you're calculating the percent change. And if you feed that into the equation again, and of course we still want to exponentiate because we've taken the natural log, you get down to here, and this is going to give you the annual percent change. I'm going to show you in Joinpoint, we'll give this to you, spit this out to you automatically. This is true. This isn't just trend data. We didn't really talk about this when we were talking about regression modeling in general. But the nice thing about regression modeling is that you can get a confidence band around that regression line, around those predicted values from the regression equation, as opposed to trying to look at individual confidence intervals, which really isn't appropriate. What you want to know is jointly, I have a 10-year, 10 data points. I want to know if the slope I see is a significant slope, if I'm doing significance testing. So I want a confidence band around that jointly is going to consider all my time points, not around each individual data point itself. So we would never do this. I've shown you that this is real data, though, from Hawaii that I was talking to somebody about when I was in Hawaii working with the health department a long time ago, so you can see it's old data. And I purposely looked at, this is Maui data, just so I would really have small sample size, so it's not the whole state, just Hawaii, just Maui. And this is real, they're real data points, and I've plotted confidence intervals. Well, first of all, they're really wide because it's small sample size. And second of all, because I do hear people say this, it's the misunderstanding of, if I have a small sample size, every single confidence interval around any point is going to overlap with the confidence interval around any other point. And people misinterpret that as, oh, I have overlapping confidence intervals, there's not a significant difference. Does somebody want to talk to me about that? Is this old hat for you? Or again, you're inappropriate. It's almost like multiple comparisons. You know how in statistical testing you don't want to make multiple tests. You're changing the error rate when you do that. We really want to know these data points taken together. Is the slope, are the predicted values from using a regression equation, is that slope significantly different? Looking at confidence intervals and whether they overlap, and again, this is true even not in the context of trend analysis, is not the same as doing a statistical test, which is going to consider those points jointly and not separately from each other. So again, even that, this is even worse, right? You would never want to do, connect the, that's not a confidence band, connecting the upper and lower bounds of those individually calculated confidence intervals, but this is. So what I've overlaid here is kept the highly fluctuating raw data, and then the yellow line is the regression line, the predicted values, and then the blue lines are the upper and lower bounds of a confidence band, which any software, even, I think I did this in Excel. So including Excel, because you're doing regular normal regression here, just with a natural log transform, you can get a confidence band around that whole regression line. And you can see I've also, at that point in time, I stuck the 2010 objective. Of course, in Hawaii, they were meeting the objective. Even back then, it would look very different if I was doing this with Illinois data.
So Deb,
Yeah.
will you just explain, so the ones outside of the confidence band would be significant compared to the general trend?
No.
Okay.
I just left the raw data, looking right into I left the raw data there because, one thing, and again, I don't even know, what I just used this internally with the EPIs or within the Title V program or whatever. I'm not sure that this is what you would present, to a broader audience. But you want to, in this kind of case, you really do want to see the real data. You don't want to lose. People often do not like when you, even like the Title V director or something, may not like just looking at a regression line. So I just think it's valuable to keep the information from the real data and then show how the regression procedure handled that real data. So it's nothing about this point. There's no testing point by point. That's the whole point here, is that I want to know, this certainly looks like there's a decreasing, monotonically at this point, decreasing trend in infant mortality. I want to know what's the null hypothesis here for any beta coefficient in any model, right? The null hypothesis is the slope is 0. So we're testing, does the slope of that line, that regression line, is it different from 0? And the confidence band is the 95% confidence band around this whole line. And so, 0 is not in there, right? I've retransformed to out of the log scale, right? So actually, so 1 is not in the confidence band. So it's the same kind of statistical testing, the way you would think about it, but it's not point by point. That's the key thing here. It's testing the entire slope. It's testing the beta coefficient. So if before you would make a graph, you would look at the beta coefficient. I think I said this the other day. Forget trend data. It's a linear model. Any beta coefficient, the p-value for that beta coefficient is a test for linear trend. May not be time trend. In this case, now we're doing time trend. It might be age trend or weight gain trend, whatever a continuous variable is. It is a test for linear trend.
For this example, you don't have to worry about violating the laws of, because it's obviously every year it's different people.
Well, that's my argument about at least perinatal stuff. And then we just heard an example, because I don't do that much child health, but I think I can definitely see how when you're looking at child health indicators over time, you might have a problem with correlation. Then you're going to you could still do regression modeling, but you're going to do a type of model, whether it's GEE, generalized estimating equations, or use one of the other time series regression models where it will account for correlation, for the violation of independence in the data. It'll still give you a set of predicted values, and you can get a confidence band and the whole thing. It's just that it has accounted for the correlated nature of the data. Still regression procedures.
Okay, that was my question, that you still use regression, it's just
Yeah.
you have to use a special kind that
Right.
accounts for time series
Right.
issues. Thank you.
Mm-hmm. The only difference here is that I've extrapolated beyond my data. Because I use the natural log transform, this is, re-exponentiated, but because the model was run with the natural log transform, then, at least I'm not going to have, again, the line is never going to hit 0. But again, where do I end up? Of course, Maui, even the upper bound of the confidence band was better than the 2010 objective, and this would look, but it is a way for you to see, at least with with a prediction procedure, right? If you want to extrapolate, it's one way to see where do we expect, where do we think that we will be sometime in the future. And this, we already really talked about this, that you want, with trend data in particular, you want to present the real data. And then we're going to talk a lot about what if there's not one slope? We've run regression analysis assuming there's just some monotonically decreasing or increasing slope, but what about, especially in program evaluation, where we're hoping we have done something by implementing a program that is going to change the slope, the rate of change. We're going to help accelerate our downward trend in infant mortality with the Healthy Start program, for example. We have to do something else so that we can identify those changes over time. The first thing is, though, you can end up over-smoothing. It's like anything else. It's like our mantra about always do univariate, bivariate, and stratified analysis before you go to regression modeling. It's the same thing in trend data. Either always draw the picture or look at the actual rates or something, because if I draw a regression line through this data, it's going to be something like that. I'm totally going to mask what's really going on in the data, which was there was really an anomaly, and this is real data. It's old, but it's real data. So you don't, again, you do not want to jump into some regression modeling approach before you've examined the actual data. Thinking about target setting and looking at and doing performance measurement too, thinking about trying to meet objectives. One way I think is for target setting is to do something like this, draw those extrapolations out, and you have some choices here in terms of setting targets. You could say, well, it looks, we definitely, if decreasing is good, if that's the directionality here, we could just say, let's set the target as though that slope is going to continue the way it is, and so then you might set your target, here for the next year or whatever this unit is. But you also know that you're still not going to meet, let's say, the 2020 objective if you do that. Or you might say, we want to be able to meet the 2020 goal. So we're going to set ourselves a more challenging target. We're going to say, we want to change the slope of the line. Yeah, we're doing okay, but this is one of our priorities. We're going to throw more resources at a particular problem. We're going to beef up these programs or start new programs or whatever, intensify our efforts around this indicator, and we know that we have to have a slope represented here in order to meet this goal, so we're going to set our next target for here. It's a more challenging one. than if you just say we're going to stay the same, status quo. And I think I said this to someone yesterday, as a reader of block grant applications, et cetera, I would much rather see something like that. And if you don't meet that target because you challenged yourself, you discuss why. You say, well, we're still, maybe you're here, so you haven't met the target, but you're better than you were. You can say, well, had we just continued the way we were, we would have met that target, but we are throwing more resources at this. To me, that's like a real functioning, working MCH program, as opposed to, we're just going to set the target to ensure that we can report that we met something, As a reader, I don't like that. And honestly, I don't think nobody in the Bureau is going to, you're not getting, right, nobody's getting dinged for not meeting a target. I mean, especially if you are obviously showing that you're doing good work around that. Another example, thinking about, so what does the picture show here? I mean, it's clearly stratified analysis, but how would you describe this picture? The thick line is the crude trend overall, and then if I've stratified on some one or more variables and shown trend lines for different subpopulations, or it could be geographic areas too, stratified by something or other. How would you describe what's going on in this picture?
Since it is a single indicator, I mean, overall, there is an increase. That's one way to.
That is one thing you could say. In epi terms, I look at this and I say, not only, let's say it's geography, just for the heck of it, not only is there some confounding by geography, but there looks like there's effect modification. The definition of effect modification is the lines aren't parallel, right? That means, right, in one strata, there's the magnitude of the effect in this case is time, is different in some groups where another. So for example, like this geographic area, right, the slope is steeper than overall. So something good is happening there. What is it? Wouldn't I want to look to see what, is there something going on differently programmatically? Is it there's just the demographics have changed over time? Is it just that they started out being the worst, and so you did throw more resources or something at that community or at that county, and so you really have made a difference? And then let's see, how about this group is barely improving. In fact, they start out being the best group back here in time, and now they've been surpassed. Like, so what's happening there? Why is that county sort of stagnant in terms of improvement on this indicator? Those are the kinds of questions you could be asking if you do trend data stratified like this. And then just to, this is about projections again, thinking about back to our prioritization process the other day, a made-up example, obviously. But if you extrapolated using regression analysis and saw where across indicators, so not, this is one indicator across different subpopulations, but in the prioritization process, we're looking at, as we know, dozens, whatever, hundreds of indicators. What if I looked at trend data for each of those and looked at the shape of the trend? What's the slope? Are we moving in the right direction? And if we're moving in the right direction, how can I project out at what point for a given indicator will we meet a longer term goal? And it might inform then which indicator do we want to pay most attention to? The one that's going to take the seems like if we keep the status quo, we're not going to get there for a long time. Of course, again, in Illinois, I'd probably have things like 2030 or, whatever. Longer time horizons. But if you just look at this little contrived example, then it might be that I want to give some more intense attention to the first indicator, whatever that is, because it's clearly farther from being able to say that we can meet the objective for that indicator. This is just a picture of that, really, thinking about where we are, except the other picture, again, we looked at was within one indicator. Now we've got indicator X and indicator Y, and being able to synthesize across the trend data and where we are currently and in relationship to a goal. So indicator Y, we're not really, it's pretty flat. And again, let's think about we want to be decreasing, okay? So good is going down. So this one is pretty flat. If anything, it's going up. Like if I went from this time point to the goal, we actually might have met it out here. Something's happening. It actually looks like it's deteriorating a little bit, right? We're on track to meet this goal, and now we're not going to meet it if we project out what's happening status quo. This one, we've had a pretty steep improvement, and continuing that improvement, we might actually meet the goal, or we're going to get close. And in fact, if I looked at this time point, indicator X was really far from its goal, indicator Y was really close. If I start looking more currently, and certainly in the projection, I'm going to be closer with indicator X than I am in indicator Y. This could have been, right, we all saw this a little bit with low birth weight. Not really improvement, but a little bit of troubling deterioration. And I like making matrices like this, and again, as help in the prioritization process too. So I've crossed how far with trend data, where we are in relation to a standard or a goal, and what's been happening over time. And I could actually, if I thought about having this matrix for 25 indicators, I would be in each cell. I could be writing, of course, right, this is the best. We're improving over time, and we've already surpassed, meaning we've met the standard or goal, so we're better than the standard or goal. How many indicators are we here? Here, well, we got sort of nothing going on in the trend data, but where are we in relationship to a goal or a standard? And then, of course, trend data going in the wrong direction, and this is the worst cell. It's going in the wrong direction, and we're really far from the goal. And maybe looking at those cells and as a way to help organize, well, of course, these indicators probably should be of highest priority. These indicators, according to this matrix, would be of lowest. But what would your algorithm be for, like, if you're in this cell or you're in this cell, and you could think through what it meant in relation to your programs and all those other factors we looked at when we were talking about setting priorities. Anything for me that's like this, coming up with some kind of matrix that helps me organize when I have to look at a whole bunch of indicators, as we do for the needs assessment, is, I find, very helpful. Now let's really delve into what we're going to think about for program evaluation. So we have a bunch of different ways we could think about it. Did we just give the program to one group and everybody got it? Did we have comparison groups and who got the program and who didn't? And these are made up, these are not based on real data, but just pictorially to think about what you might see as you look at time trends when you've implemented a program at one point in time. So this is just one group. I've got one trend line. Nothing much seems to be going on there. You could say, if I drew the regression line through the data, would the beta coefficient be significant or not? Maybe yes, maybe no. Unclear. Here it is, also one group, but now it looks like maybe the slope has changed right about the time our program happened, right? Something does look like maybe it's happening there. And if I just use regular regression analysis, it's going to smooth the data and draw one line through it, and I wouldn't see that. In program evaluation context, we want to be able to identify these inflection points. And do inflection points coincide with with us implementing something? So this would be with two groups. It does look like there's inflection points, but the inflection point looks like it's happening in both groups. What might that mean? What might be an explanation for this picture?
Another factor cost.
Or in that Cook and Campbell, could be secular trend, right? There's something else going on out there in the greater world that regardless of the program, we're seeing improvement. You also can't immediately tell from this which group got the program. Did you target just the high, are the groups, how equivalent are they? Was it the higher risk group? Was it a lower risk group? Who was in your program? A different picture where they start out kind of the same, and then you actually, so the more equivalent groups at the starting point, and then you did see divergence. So you might see a picture like that. Here's another. You can imagine these pictures should help you. I guess what I would say is, if you state what is your hypothesis about your program? Which groups will it affect? Will it affect groups differently, even those people in the program? Do you expect everybody the program to affect everyone the same, or maybe there's going to be differential effects? And if you state your hypotheses about what you think the Healthy Start program is going to do, then you should be able to draw a picture like this that mirrors what your hypothesis is. And then you can check it with empirically when you actually do data analysis. So just some more pictures. Lots of stuff can happen, right, over time that it sort of helps you think through, like, well, if I had this kind of selection bias, how would that change the picture? If I had a lot of, program dropouts, attrition rates, how might that affect the picture? And draw them. I think it really helps to think that through and say, oh, well, then I would see something like this. If that kind of bias was operating, the picture would end up looking like thus and such. So when we look at those pictures and we think about it in terms of in regression analysis, we can think about those regression parameters. Is there going to be a change in the intercept? Is there going to be a change in the slope? Is there going to be a change in both? Or, of course, neither, which would be the null hypothesis. And how can we look across groups at those same kinds of changes? How can we, whether groups are comparison groups or stratified by some other, maybe the program was implemented, but implemented differently in two geographic areas, that sort of thing. So I want to talk to you about Joinpoint, and actually, I think I can do one really. Do people in here use Joinpoint already? Joinpoint is this cool program, and then I'm going to show you in SAS. You can kind of, mimic it in SAS. But Joinpoint is very cool because it automatically is going to identify those inflection points if they exist and give you kind of alternatives for alternative explanations for what you're seeing. It's free and it's little, and I was just telling somebody, I'm going to show you one little example. There's a new version out which I downloaded, and of course I got up early this morning because I just knew, as with any software, there was I had to sort of play with my input file to get it to run. So hopefully I can get it to run for us too. So instead of the old version I've been using for the last 4 years, I now have the new version. So let's talk just a little bit before I go into the program about how this works. So of course it is, like any statistical procedure, based on, in the background, it's testing null hypotheses. And so with Joinpoint, what you as the analyst, you'll see, I can ask it to say, I could just ask it to look at one join point. Like if I say, I implemented a program in such and such a year, just show me whether there's an inflection point there. But you can tell the program, look for 0, 1, 2, 3, 4, 5, however many, although it starts, I think you get a message. Like if you ask for it to look for 5 join points or something, you get this thing saying, do you really want to look for 5 join points? It's going to take a long time to run. And why would we? What would that tell us? That would sort of just tell us there's no trend, in my opinion, unless you had some reason to think that 5 different things happened over time. So it starts out with a null hypothesis where the null is the minimum, typically 0 join points. So like there's just going to be one slope, like a regular regression equation, and then the maximum that you specify as the analyst. Then it's an iterative process of testing that null hypothesis, and depending on the results of that initial test, if the null is rejected, meaning it looks like there may be an inflection point, you're going to start increasing the number of join points in the null hypothesis. And conversely, if the null is accepted, you're going to start working down, the program, not you, is going to start working down from the alternative hypothesis. I have a little trivial example here. So we're going to start out saying the null hypothesis is there are no join points, no inflection points, no changes in the slope of the line. And we asked it to test as high as 3 for 3 inflection points. And I've said, well, it does the first test and the null is not rejected. So the next test, it leaves the null hypothesis the same then because we couldn't reject it. But now the alternative hypothesis, H1, is now 2 join points instead of 3. We've backed off of that. The null of 0 isn't rejected again. So now it's 0 versus 1 inflection point. The null is not rejected again, where the procedure is telling us there are no inflection points at all. Yeah?
Please put it in a context and give an example or something.
Well, we're going to actually do one in real time. But again, it would be, you've implemented a program in the year 2014, or well, that doesn't, in 2009, and you're hoping, one of the ways you're going to say the program's made a difference is the slope changed after 2009, right? We had an impact. There, you're hoping there's one inflection point, right? So you want there to be one slope up until 2009, and then you want to see that slope changing after 2009. You'll see an example when I go into the program itself. So the other direction is same start point, 0 and 3 in the top one. Null is there's no join point, nothing's changing over time, and I shouldn't say nothing's changed. The slope is not. The slope could be significant, but there's no change somewhere in between time 1 and the end of your time period. There's no change in the slope over time. There's just monotonic decreasing, monotonic increasing. Here we're saying the null is rejected. So we're saying there are some inflection points. How many are there? So now we're testing H0. The null hypothesis is 1 join point versus 3. The null is rejected again. So now we're going to increase the null hypothesis again. Is it 2 join points versus 3? And now the null wasn't rejected, so we've ended up with, we're going to say the best model says there are 2 inflection points, 2 changes in the slope. Okay, let's get out of here, and let's just keep your fingers crossed that I can get Joinpoint to work. I got it working this morning. So here's the program. Come on. There it is. So I already have a file. This is, again, trivial data, but it's as though it's infant mortality rate. So here, this is like from an Excel file. Basically, the data were an Excel file, and you output it to, you know, either a CVS or just an ASCII file. No Excel. Whoop. No Excel directly. So this is what the data look like. And I was experimenting, so like when you see rate 1, rate 2, rate 3, I was, just for examples, I've rigged rates so there is or there isn't, there are or there are not inflection points in the data. This is just, everything's made up here. So down here, I'm not asking the program to calculate anything, so I've provided the dependent variable are the rates. So I'm clicking provided down here, and it's not count data. The data are already rates, and you can see what your other choices are there. So I'm going to click OK, and then I know that it wants blah 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 blah. Let's do my grouping variable. Believe it or not, is called group. So we're going to do that there. And my independent variable, what's my independent variable for trend analysis? Is year. And then let's look at, I think I ended up, what I got to work, let's look at rate 6. Oh, sorry. Thank you for noticing. See, I wasn't precise enough in my clicking. And then I also, in the Excel file, I hand calculated, in the function, I have calculated standard errors for these rates using the Poisson formula. So I'm not asking the program to calculate it. So that was rate 6, so it's SE6 for the standard error. I want to feed it. And then you can see by default, I don't have to click anything here. Do I want the log transformation? And it even shows you, the little regression equation. And I do want, and it's giving, by default, Joinpoint is going to do the natural log transformation. Okay, so then I am going to say execute. Looks like it's working. Uh-oh, now look at this. Why is it doing this? I don't want to do this. I just thought of something. I think by default, if I ask for fewer join points, I didn't change, I can't remember what it did by default for the number of join points. It was, let's do it one more time. Isn't this what it's like? Have you ever run a SAS job that ran the first time without any syntax errors or anything like that, Year, let's do this again. Group, okay, crude rate. Oh, see, it's asking, okay, you didn't see me point to that. Hold on, I am gonna try this. 6, oh, I hope this is what was wrong. So up here, do you see how it's, let's look at, let's just say 2 to try and get it to work. Let's leave it like this, and now let's try it. Oh, please work. So, God, temperamental, you know. So what you see up here is, it's, you know, because I had a grouping variable, so, you know, I coded things, excuse me, 1 and 0. So what it's seeing from that ASCII file, this is cohort 1 or cohort 0, because I had 2 groups. So we're looking at cohort 1 data. You know, one thing I don't like about Joinpoint is it doesn't overlay. You know, you have to look at the cohort separately. But so here, it says, it's telling you, we asked for 0, 1, or 2 join points, and it says there was 1 join point, and you can see where it is. And just before we look at the other data, I can say, well, okay, statistically, you're telling me there's 1, but what if you also ran it for 2? So it'll show you under the hypothesis that the alternative hypothesis of 2 join points, since I asked for that, but it's saying statistically this isn't the best model. It told us that there was 1 join point, but you know, if you are interested in what's been going on historically in some indicator, you know, again, you don't want to necessarily totally just rely on the statistical results. And what if I say, if I just drew the regular regression line? So here the points are the raw data, and if I had just run regular regression without looking for inflection points, here's the best single straight line through the data. But Joinpoint told me there indeed is 1 join point, so it puts a nice little asterisk there. And then you see there are these tabs. So here's the graph, here's my Excel file, you can look at your raw data. Here's the modeling results, so you can look at the beta coefficients, and because it said there was 1 join point, you've got different slopes. So you've got beta coef, 2 different, you know, it's the coefficient for year. You've only got 1 variable, 1 independent variable in this model, but you've got 2 slope parameters because there was 1 join point. And you can, actually, I'm not sure, to be honest with you, I don't know what some of these other trend, you know, tests are and all that, but actually I wanted to point out to you, where is what I'm looking for here? Maybe it is here, is this? Oh yeah, so here it's giving you also the annual % change and the average annual % change. So that's, you know, rather than you having to hand calculate it or so, I mean, again, based on the regression model is the average annual % change. So that is really cool. This is only cohort 1 though, right? So if we go into cohort 0, whoops, what did I do?
It just didn't change.
Because, oh yeah. Okay, so let's go back, start with the graph. So here's the other cohort. And what did it tell us? That there's no inflection point here. So if this was, you know, this is the group that didn't get the program and the other group did, you've got a statistical test telling you there was a change in the group that had the program, there was not a change in the group that didn't. And again, then you've got the same things. You can look at the data. You only have 1 slope parameter because there's no change. You've got regular regression going on. You can look at the average annual % change again. So this is kind of cool. The only thing I don't like is I would really like to see the graphs overlaid, but I mean, you could do the graphing yourself, you know what I mean? You could get this to work. So that's Joinpoint, and you know, I think it's a really useful, and you can see how easy once you get it to work. It is to use. You do have to organize your data in a certain way. Okay, let's get out of here. Oop, sorry. No, let's just get out of here. Thank you. So I wanted to, what slide was I on? 30 something? Oh yeah, a little past that. Okay. So in SAS, just because, again, I'm kind of a geek here, you know, we're not going to spend a whole bunch of time on this, but I've given you code for thinking through how to do manually piecewise regression, or looking for the inflection points yourself, because I think so you can actually see this gave rise to the Excel file when I ran this. So you see this rate 1, rate 2. We just looked at rate 6. This was my input statement. And then the idea that I've created a new variable, created the variable here. This is where I think the change, so I've created, this could have been, you could have called it program. I've identified the year at which I'm going to hypothesize there's an inflection point. And so that's just a dummy variable. It's like program after the program, before the program. And then I've created a new year variable that instead of going from 1 to 15 or however many data points, the 0 point is going to be where you think the inflection point is. And then if it's before then, it's going to go -1, -2. How many years before? 1 year before, 2 years before, 3 years before, and then positive moving forward, 1 year after, 2 years after, etc. And you can see that when I go, using 1999 as the anchor, right? So I'm going to get -1. If it's 1998, it's going to be 1998 minus 1999. I'm going to get negative numbers before my inflection point, positive numbers after. And I've just done the plugging the numbers in the equation and thinking about what it means to have main effects. And remember, we don't have real covariates here. We have some rate as an outcome. I can add covariates. But really, all I've got in the model is the year, this indicator variable for when I think there's going to be an inflection point, when my program was implemented or not, and then interaction terms. And then I also, you'll see in a minute, add group to that if you're doing group comparisons. And I've just plugged the numbers into the equation, thinking about what does it mean, because what you end up seeing here is just how the slope or the intercept changes. So here's the slope. This is when, this is just for one group, and this is though when change, the dummy variable equals 0. So this is before the intercept and slope before the program. So I have intercept and my slope parameter. If change equals 1, I've combined terms. The intercept changes a little bit if what? If B2 is significant. B0 plus B2, which is the new intercept term here, if the slope for where the program change is not statistically significant, this is really small, this will basically be the same as B0, right? But it's allowing for the fact that if there's a change, this intercept is going to change, and the same thing here. My slope parameter changes if, this is the interaction term, it's the meaning of, that's the slope changing. I have interaction going on. Again, if that interaction term is not significant, so I'm running a model to say, I think our program made a difference. There's an inflection point. The slope after the program is different than the slope before. Well, if this is an insignificant, if I look at a p-value, this will be 0, right? And then I might just reduce back to what I had before. Does that make sense to you? So we're just looking for changes in intercept and slope. And I've just gone through this again. Sometimes this one is the main effect for time and only the interaction. Oh, this always, when I first was doing this freaked me out. How was I trained in epidemiology? If I'm going to put a product term in the model, I must have all the main effects in the model as well, right? But these aren't kind of main effects. I mean, we don't have a variable. It's not like a variable for age or a variable for any other kind of substantive covariate. These are just, indicating did change occur and when was the program implemented, et cetera. They don't hold any other kind of information. So in this context, I can have a model that has interaction terms in it, but not both main effects, because that's gonna get us to, look, no change in the intercept here. The intercept stayed the same, but only a change in slope. This is just a one group comparison, remember. So I am trying, based on those pictures, which I think I have again here in a minute, I can think through what does that picture describe? What kind of model? Is the intercept changing? Is the slope changing? Are both changing? And this just gets more complicated, and I don't want to spend the time going through this. I've just plugged and chugged again, thinking about under different conditions. What happened before the program, but now I'm also comparing two groups. So now I have group in the model, and I can have all the various interaction terms with group too. Again, not a substantive variable like age or race or geography or any person, place, or time variable like that. These are just helping me understand just in relation to when I implemented the program. And I've just gone through every possibility here. And I think what I have, I ended up writing what can I get, figuring out what I want to look at. What was the intercept before the change? What is the intercept after the change? What if there was an immediate change? The lines dropped. What if there's a slope? What's the slope before? What's the slope after? And I can get, why would I'm just showing you this because it helped me sort of understand what's going on even behind the scenes in Joinpoint. I mean, why would you do this in SAS? You can get this all from Joinpoint. And then I just, in SAS, I tried to reproduce the kind of plots that you get in Joinpoint. Given the way, whether I had interaction terms in or not in the model, I could get SAS to actually print me the graph of the changing slope or the changing intercept. And here they are again, thinking about these hypotheses, right? Up there is, I actually have no interaction there, right? Those are parallel lines. It's just that right when we implemented the program, something happened immediately. So there's a change in intercept. Right away, there was a change, but then the rate of change after making that immediate change stayed the same as what had been before. Here's where I do have interaction, not really no immediate change right here, but I've certainly, the rate of change is different. And here it's both, right? I have some big discontinuity in the regression line right at the point the program started, and I also have a steeper slope. So anyway, I think Joinpoint is a really good tool now for us to think through what our expectations, what are our hypotheses about our programs, and what does that mean, what do we think we will see when we look at trend data. I was telling the Wisconsin people, so I like to use, does everybody in here know about the Dane County, which is where Madison is, example? We'll just go through this briefly. I really like this example because there's been really good epi work there. There was a lot of even, just mainstream media press about this because it looked like in Dane County there had been real improvement in the black infant mortality rates, so that the disparity, black-white disparity was disappearing. And so I've just put in, there's a whole lot out there, but this was showing the real data by race, ethnicity, and these are 3-year rolling averages. So I think, the methods used here were really great. So that was the picture that we were looking at. And then they actually, every year I say this. So this is LOES, I don't know if that's how you pronounce it, locally weighted polynomial regression. You can do this in SAS. And it is a regression technique that I think, so let's just look at this. It's instead of just a regular parametric, is it the normal distribution, modeling technique, it's a non-parametric method. So it doesn't, parametric meaning, right, it's a linear model, we got a straight line association. This is a more assumption-free method, and it looks at contiguous data points, in groups, and then runs parametric models with it just in those neighborhoods. Excuse me. And as the analyst, you can help define what those neighborhood, which contiguous points you're going to look at, and then you can draw the trend lines. Anyway, this was the picture. It's a highly, it's a sophisticated method, and this was the picture that they got, and it definitely, you can see kind of the shape of that trend in the black infant mortality rate, which is this top line that then steep drop, apparently. So using really good methodology. Here's Joinpoint, and this was not me. I mean, Dane County did Joinpoint regression, so this is some output from Joinpoint. And there was this hypothesis that this apparent drop had to do with very premature black infants, and that something was going on there. And I should say, the CDC got involved in this, and it was in like Newsweek magazine, and this was a huge deal, right? This is really what looks to be a dramatic change in the black infant mortality rate.
Have they implemented a program?
Well, we're going to get to that. Okay. So I've given you. I've been following this. So since it started happening, in 2010, I've been every year I see, okay, what's happening now in Dane County? So you can see this is just from, from the press. Health officials, puzzled by the mixed picture, say they will investigate every infant death and hope to expand home visits to pregnant women. The county's racial gap has returned, with 3 times as many black babies dying before their first birthdays compared to white babies, a chasm that had vanished, they thought, till 2007. It's not so simplistic anymore, Schlenker said. This has become very complex. This is like Pat's complex problem. So here's some more data analysis, just more investigation. And then again, Dane County's black infant mortality rate, which dropped for several years and became a national success story, shot up again to 4 times the rate for whites over the past 3 years, leaving health officials stumped. Schlenker said, he still thinks the positive trend of the last decade was real, but so is the pattern for the past 3 years. Unfortunately, it's not a fluke, he said. And anyway, goes on and on and on, and actually to, using 3-year averages, et cetera, et cetera. Lots of time and attention to this, and if the Wisconsin people want to talk about this, you obviously can. But to answer your question, so much more intensive, femur stuff going on, thinking about safe sleep, and this, let's see, this was a couple years ago, I think. And then this is the more, I just keep looking for the most updated news reports. And so I think this is we're getting to the close. So public health officials will launch a safe sleep campaign in May. Addressing socioeconomic factors will require a broader effort. Of course, now Wisconsin's part of Region 5 COIN, and of course the whole region is focusing on social determinants of health and safe sleep. Those are both our COIN priority areas. So some of the initial work thinking about safe sleep, of the 12 black infant deaths in 2011 and 2012, 5 were classified as sudden and unexpected. All 5 involved co-sleeping or sharing a sleeping space. 5 of the 12 Black infant deaths in 2011 and 2012 were preterm births. When Black infant deaths dropped a decade ago, health officials thought the improvement may have stemmed from the drop in preterm births. But since infant deaths have risen again, while preterm births have continued to decline, the situation appears to be more complicated. So, and I want to give, anybody from Wisconsin want to talk about, you don't have to, but anybody want to say anything about that? Or, I mean, to me, this is an example of good epi work. I mean, nothing was done that was wrong statistically or any other way, and they actually sought help from the CDC, and the it was being published in MMWR and everywhere, aside from the mainstream media, in the scientific literature and all of that. And I think it is just a cautionary tale about small sample size. But what I would say is, look at what's been learned from this experience and how it is being connected to programs, and a deeper understanding of just not the black-white gap, but, well, is it preterm births? Maybe not. That was what was originally thought, but now we've deconstructed a little more and looked at following the preterm rates, now looking at safe sleep, doing intensive case reviews, all of that. So it's been very much, the epi piece has been very much linked to all the programmatic efforts. So, we're almost done. I wanted to throw in, again, because the coin work that I'm involved in, I'm finding myself all of a sudden working with QI data and clinicians who are interested in QI data, and we've done a lot of work in Illinois, as have most of the other states, with early elective deliveries, and so it's really made me have to learn, what the heck does that mean that this is QI data and not my usual population-based epi data? And the clinicians are, and the American Hospital Association is making presentations and using terminology I don't really know and all of that. So I thought that I should at least help us start our conversation, or, I mean, many of you are probably way ahead of me in this, but I wanted to try and articulate some of what I'm seeing now. So it's still, very much an interest in looking at trend data, but how does that trend data for QI work? And please, those of you who are doing a lot of this work, I mean, tell me if I'm totally off base here or not. But how does it differ from the trend data for surveillance or for program evaluation in the way we've been talking about it up till now? So some of it has to do with, well, first I put this, data are collected continuously, and then I thought, well, technically birth certificate data is collected continuously also, right? We don't get it as the EPIs continuously, but it's collected continuously. So I'm just raising these as issues to think about, because that's what I'm thinking about. And so that's sort of the next point. The data can be accessed and displayed, and analyzed and displayed continuously, which at least in my state certainly is not true with birth certificate data. Typically the time intervals are shorter, quarters, months, or even days, whereas we've been looking at years, more at the population level. Sample sizes are typically really small, depending on the indicators you're looking for, but if you're looking at, early elective deliveries, how many people, the numerator, even the denominator is really small, the numerator is really small. Not necessarily a focus on comparison groups, so you're looking at, one group trends. Not a focus on statistical testing, which is actually probably, in my view, fine. And more of a focus on processes rather than on outcomes. So thinking about, I'm just learning about run charts and control charts. And, if you, from a statistical perspective, this made me think of, it's really about, because of small sample size, moving out of our typical parametric framework to a non-parametric framework, right? So there's even a runs test. I mean, that's a non-parametric, which I'm not saying you do that test in QI data, but I'm just saying even the term itself triggers thinking about this is not, we're not making any assumptions. This is normally distributed, or this is Poisson distributed, or anything like that. We have non-parametric data because we have small sample size. And runs then refer to those kind of neighborhoods of contiguous data points. And at least in the brief look that I've done in the literature, and somebody tell me if I'm wrong about this, I've seen all sorts of, there's kind of rules of thumb, but there's not, I've seen 5 data points in a row. I saw, I think, 7 data points in one article I read. So I don't think there's a rule about what constitutes a run, but it's the idea of monotonically decreasing or monotonically increasing sets of continuous points. And then the only difference that I understand now, Bill Sappenfield, who's worked with this for a lot longer than me, he was telling me he thought there was some other more complex control charts. So if people know about those, tell me. But my understanding of a control chart is it's really also a run chart, but it adds some benchmarks. It adds lines. The lines might be, so if you have 9 months worth of data, so you have 9 data points, it adds the mean across that whole period for that 9-month period, and the standard deviation, or a 95% confidence interval around that mean, and just adds those lines to the chart so you can see what the fluctuation in the real data, the month-by-month data, and are you above or below or at the overall mean or near the upper bound or lower bound of some limits that you've set. And then you can look at those runs. Do you have 5 points in a row that are above the upper limit? Here, I think I have some pictures. Yeah, so here, this was really nice. Did I give you, I can get you the reference for this. I guess I didn't plunk it in here, but I really like this code. So this kind of shows what you might see in these kinds of charts. So here, the data, of course, is fluctuating a lot, but here's some kind of benchmark, and you see this group of contiguous points looks quite different. Again, it's almost like seeing an inflection point, but you don't have enough sample size to do a regression model, so it's a non-parametric approach with the same idea. And here, you're not only seeing above and below the line, but you're actually seeing slope changes in our terminology, right? So 5 or more points. And then what happens here when you can't really see anything? Nothing seems to be going on here. This is, again, this is the median, not the mean. So a non-parametric measure of central tendency instead of a parametric one. And same thing here, we've got a median, and we've got some outlier. And what does that mean? It's, again, thinking about what your hypotheses are. Is this here, somewhere around here, if this is early elective deliveries, a hard stop policy was put in place, something like that. Yeah? Microphone?
So I know that one of the leaders in this work is the University of Cincinnati, and they actually have a class that is relatively recent, within the last 2 years. They do a class for basically people that are in the industry, and they use real-time examples, and everybody's assigned a project that they're really working on in the real world. And they have a whole program that's set up where you actually it's very user-friendly. It's not meant for statisticians. You just enter your data points, and it gives you the run charts and the confidence intervals. And is this like an Excel macro?
Yes,
or something
it is.
like that? Yes, it is. And the class lasts over I think about 4 months, where everybody in the class comes in with their real world examples, and they go through this whole process. The other very different thing about the quality improvement projects that we've become very involved with in Ohio is that you go into it, and it's of course usually just in a very small area, and you're working with the providers in the community, and like every week you have a meeting, and you change policy and practices all the time based on feedback, and so it's so
that's a very good point. So another difference with our usual surveillance or even program evaluation work is the sort of constant and continuous, as the name of continuous quality improvement, the fact that you're changing in real time and in short intervals of time. I mean, we want to tweak our bigger programs too, like Healthy Start, but that happens longer intervals of time. So we're running out of time. I just wanted to give you some other examples. So this was from Minnesota. I just wanted to show you some examples of what other people had done. This one is Florida, so I'm sure Bill must have been involved in this somehow or other. So again, the non-medically indicated elective deliveries, and just a way that they overlaid, just not just looking at the whole group but going and looking at inductions or C-sections or whatever, and how they constructed a chart to look at that. And here's another example. Are you familiar with this? Because Ohio, I mean, do you recognize this chart?
Absolutely.
Yeah. So,
Applegate, Patrick.
yeah. So, and I should say, Ohio, in my world here in Illinois, actually, Ohio is held up as because the Perinatal Quality Collaborative in Ohio is just as in Florida, and there are some others, California, New York, North Carolina, highly functioning. We have kind of an emerging Perinatal Quality Collaborative here, who I am working with, but we're not nearly as far along as some of those other states. But I did want to show you, so this is some work, because as most of you know, anybody who's been working with the coins, for example, in regions 4, 5, and 6, that Bill Sappenfield, wrote SAS code to be able to, instead of just with clinical data, but using birth certificate data, look at early elective deliveries. And we implemented that here in Illinois. We actually, I know this might not sound like a big deal to some of you. This was a breakthrough for us. It was the first time we had access to provisional, this was about a year ago, provisional vital records data through 2012. That's the first time ever anybody has, and this is within, even internal to the health department, not me as UIC. This was even within the health department. The MCH program and the other EPIs had never had access to provisional. So this was, for me, one of the successes of the coin, is that it's pushed that kind of capacity building in the health department. So this is one way. We have a regionalized perinatal system here. We have 10 perinatal networks across the state. And so one thing that we did just with the vital statistics data is we provided every hospital with their trend line, the trend line for the perinatal network that they're in, and then for the state overall. And we also then gave them numeric other more detailed data, but I just wanted to show you the way at the population level we had 3 years of data, the way we gave them some other information, even not going to the clinical data yet, which we're going to also do, but using Bill's SAS algorithm, which we had very interesting, by the way, conversations with him about, because there were some things we weren't sure, well, wait, there are a lot of exclusions, for example. You know, why were those women excluded? You know, that kind of thing. And it was very enlightening. So then I'm done. I mean, we're going to have this conversation in a little while. This is just, you're seeing my stream of consciousness here, because I'm really thinking about, you know, what are the ways, how really different is QI from population-based epi? Is it really different, or is it just that it's terminology different? Is it that it's different because it's come out of another discipline? And how much do we bring our same epi principles to bear, whether it's on QI work, program evaluation work, more classic epi, whether it's etiologic epi, population-based surveillance, all of that. I tend to want to have a more synthetic view of things and not have us, oh, well, now I'm in the QI world, so I do this. Oh, now I'm in the epi world, so I do that. That's not my natural way of thinking, and we'll have an opportunity to discuss that more later. So I'm just priming the pump, if you will. Okay, we're done.